And welcome back to the show. Communities and special pharmacies continue to stay open during the COVID-19 pandemic to deliver essential counseling, information, and medicine supply to their local communities. A recent New York State policy would disrupt care for vulnerable New Yorkers on Medicaid and threaten the financial stability of safety net providers. Despite facing extreme financial loss, pharmacies continue to serve their community. Many people of color face challenges in having access to medical care in the United States. COVID-19 has greatly contributed to the problem of medical debt in the U.S., and communities of color are especially vulnerable to medical debt, just as they were vulnerable to the pandemic. Joining us now to provide a little bit more on this point of view and this matter, I'm joined by the Director of Operations at Carmel Pharmacy, Javier Maldonado. And Javier, good to have you.
Pleasure to be here. Thank you again for the opportunity.
Thank you. And when we talk about local pharmacies, obviously your pharmacy is a specialty pharmacy. I'll give you an opportunity to share a little bit about what how your pharmacy operates, but share with us a little bit about pharmacies in this pandemic, because you also have been essential workers.
Sure. Thank you again for the opportunity to be here with you and have the platform to speak to these topics. During the pandemic, absolutely, pharmacies and their employees and staff are frontline workers and were considered essential workers. What's interesting about that conversation, that piece, for the longest time, pharmacists have not been considered healthcare providers, which has a much deeper impact to the practice, to the business, and to the profession of pharmacy. But during this pandemic, we have finally fallen under the umbrella of healthcare providers. And I think for the first time, the healthcare system, the politicians in Albany have all finally recognized the value and impact that community pharmacies make on the communities that they serve, and to the people that they're dispensing medication to. Pharmacists and the industry of pharmacy is absolutely essential employees, essential healthcare workers, healthcare providers, and are absolutely integral to the whole healthcare system.
When you talk about providing that service to the community, it's integral to the community. Talk to us about community and how they've basically been coming through your doors throughout the course of the pandemic in a much needed way.
Absolutely. So during the pandemic, there has been a lot of fear, a lot of misinformation about COVID, about the vaccine. And that pharmacy, that community independent pharmacy, again, being the beacon of hope in that community, is there to provide accurate and professional advice and information regarding COVID, regarding everything that's been going on with this pandemic. And for many people in our community, quite honestly, it's a source of information. It's you have so much misinformation in social media and on so many different internet outlets. For them to hear it from their pharmacist, from their licensed community professional, means a lot more, and there's a lot more trust in the community with their independent community pharmacists.
So as a community pharmacist, one would ask the question, how do you differ from that of the big name? So somebody says, I see the big name pharmacy and I got a community pharmacy. Talk to us a little bit about that difference.
I think the biggest difference, not only that where we can compete in, but I think where independent community pharmacies clearly excel beyond the chain is the level of service. And when you think of service, it's a commodity. It doesn't matter what industry you're in, what space you're in, whether you're a grocery store, a supermarket, a gallon of milk is a gallon of milk. And how you provide that service or that product to that end user, that end customer, that end patient is what makes that individual continue to come back. And I often go to the example of Dunkin' Donuts and Starbucks, right? Two companies that are selling coffee, but the experience you get in when you walk into those establishments is very different. When you walk into a Dunkin' Donuts versus walking into a Starbucks, from the name of the drinks, the name of the size of the drink, to the atmosphere, the music, the lighting, all of that ambiance creates an experience for that customer. And so I think the overall experience for the customers and patients when they walk into that community pharmacy is very different from what they would experience from a big box chain. I would equate it to college. When you're in a classroom or a lecture hall of 500 plus students, all you are is a social security number, versus being in a small class setting of 20 to 30 people, you have that one-to-one relationship with that professor. similar philosophy, ideology, concept when you're thinking of pharmacy or community pharmacy. Individuals have that one-on-one access to that pharmacist. They know their pharmacist. That pharmacist, in many cases, has been in the community for generations. And so what that community pharmacy, independent pharmacy brings to that community is very different than what the big box stores will bring. And often when you think of those big box stores, it's not Walgreens pharmacy or CVS pharmacy. It's the big box name with a pharmacy within, right? So it's a pharmacy department within that store. Community pharmacy is all about the pharmacy and healthcare and providing that service to the patients. And service is where we excel. It's where we perform best. And it's where I think we stand out against our competition.
We talk about community pharmacies, and there definitely is a need for them, but they do come with challenges. I want you to share a little bit about some of the challenges you're facing presently right now, and even, navigating through COVID.
So when we think of the challenges of an independent pharmacy, the biggest challenge is around reimbursements. It's how we're compensated. It's how we're paid for the services we provide. For independent pharmacies, it's a challenge. There are many services that we provide to the public, again, because we're in this space to care for the public. We're in this space to care for people who have medical conditions. And at our core, it's not the business or the financial side of it. It's the healthcare, it's the patient outcomes, it's providing that patient the service and healthcare they need. And so when you think about the services that an independent pharmacy provides, from free delivery to free adherence packaging, to free patient medication counseling, to free medication synchronization, to blister packing medications, all of these services have a cost to them. And it's a cost that the independent pharmacy bears, unfortunately. And it's not a cost that's passed through to any insurance company or any patient. It's a cost that we absorb to provide what we feel is the best class service that we can provide to our patients.
And when we talk about patients receiving service, obviously communities are very much beneficial from the fact of having a community pharmacy, having those services there, being able to go not so far away, and having somebody that actually knows them. Talk to us about this as I get into this, because when we talk about vaccine, there's a lot of sometimes vaccine hesitancy, particularly in communities of color. How's it been for you in terms of people responding to the vaccine, given the fact that you've got a pharmacy and a place where, people can come and be vaccinated?
So you bring up a very interesting topic, especially in the world of healthcare, and you're touching on what would be categorized or fall under social determinants of health, right? And so when you're talking about social determinants of health, you're looking at economic stability, you're looking at neighborhood, physical environment, you're looking at education, access to food, you're looking at community and the social context, you're looking at the overall healthcare system. And pharmacy is really where rubber meets the road, right? It's where all of these pieces come together. And so what I mean by that is, take the vaccine hesitancy example you're giving. The pharmacy and the community independent pharmacy is a beacon where information can be provided to individuals to help with vaccine hesitancy and dispel any myths that may exist around vaccine. And that holds true for many of the other topics that are either misunderstood or not properly explained. And the education, the literacy behind a lot of the information in healthcare sometimes needs to be broken down a little better so that the individual can truly understand. And I think that's where the independent community pharmacy adds value to those components of social determinants of health, where we're able to educate our patients, we're able to give them accessible care to pharmacy and medication counseling. Being within the community adds value to the community that we serve, being that professional medical institution provider helps with the community as well. And so when you think of all those pieces, as well as the healthcare system and the role that the pharmacy plays in providing the medications that the doctors prescribe, all of those pieces come together in the world of pharmacy.
Yeah, but you've been doing a great job of really keeping the community healthy, especially in a time when you've lost income, money, reimbursements haven't been coming. How's it been for you navigating this whole thing?
It's been a challenge for the most part. You know, we were hoping on changes coming through with the Medicaid fee for service, and with legislation allowing that to to come to fruition. Unfortunately, that is not the case, or does not appear to be the case, and it leaves us in a position where reimbursements are unpredictable. It creates a revenue model that's unstable. It creates a revenue model that's um, difficult to manage a business and scale a business and move a business forward when you don't know what your reimbursements are going to be, or what you get paid today may be clawed back tomorrow. And so much of the reimbursement around pharmacy needs a brighter light shined on it, and more transparency into how these PBMs operate, how reimbursements are occurring at the pharmacy and insurer level.
When we have communities of color, we know that there are health disparities. As a pharmacy, as a director of operations, I would ask that, tell me about your experience and what you've seen regards to the health disparities with communities of color, and your perspective.
So for me, it might be a little challenging trying to answer that question, because the majority of the public that we service are minorities and individuals of color. And from my perspective, the service that we provide to them is equal across the board. And as far as conversations that I have with the audience and public that we serve, and their experiences at other locations, at other pharmacies, at other healthcare providers, is not always the same. And the information that's provided to them, or the time that an individual will take to explain the medications that that individual was receiving, that experience, again, going back to what that customer experience looks like, is not the same across the board. And to bring it back to the question you asked previously with regards to how we differ from chains, bringing this topic up is one of those places where I think we would stand out against chain pharmacies, where we truly are focusing on the community that we serve, and every interaction, every question, we focus in on that individual. We do our best to provide the best counseling and advice to that individual, and treat everyone the same, regardless of color, race, nationality. I don't think you'll find that at a lot of other locations, as far as the feedback we're getting from some of our clients.
Yeah. And, there is a sense of safety when you have a local community pharmacy right at the door. Talk to me about that relationship, because you do talk about, you talk about it's easy. You talk about, you have more time to talk about medicine and prescriptions. Give me a little bit more on that.
So think of it like your local barbershop, right? You're going to your barbershop to get your hair cut. You're talking about the recent Floyd Mayweather boxing match, and there's a sense of community there. There's a sense of belonging there. And that's not a feeling that you'll get when you walk into a chain pharmacy. That's not a feeling that you'll get when you walk into one of these big box stores. So when I say that it's accessible to the community, that's what I mean. I mean, the community, and not only is it accessible to the community, but the community feels comfortable. The community has a level of trust with that licensed professional who's been serving that community for generations. So many times when we're servicing our patients and having these conversations with our audience, they're generational. Their family has been coming to us for decades. And so it's the grandmother, then the mother, then the son, and now the son's kids are coming to the pharmacy, and you have that feeling of belonging. It's kind of like the TV show back in the days, Cheers, where you walk in and everyone knows your name, right? So that feeling is priceless. And that's the feeling you get when you walk into a community pharmacy.
Yeah. And when you talk about the feeling, I mean, obviously there's some great feelings that people have by having access. And I think the key word today is really access to healthcare, access to prescriptions, access to getting the help that they actually need to help them through their medical challenges. But if a community pharmacy is not present and you're not there, how big a gap is that for a community?
Well, let's hit pause there for a moment. If everything we discussed and all the value that an independent community pharmacy brings to the table, brings to the patient, brings to the community they serve, you eliminate that and take that beacon out, what do you have left? You have a very large void leaving patients leaving patients to find other locations to get medication filled and have to travel distance to get advice that they were previously able to get just by walking down the street. So when you take that pharmacy out of the picture, you eliminate the ease of access to healthcare. You eliminate the ease of access to sound, professional, licensed advice on medications, on how you're feeling, on what your symptoms are. You lose access to information. You lose access to the level of service that a community pharmacy brings to the community that they serve.
Before we go, I want to have you an opportunity to share a little bit about your pharmacy so people can know exactly where you are and where you're located.
Sure. So we're located in the heart of Little Italy. We're on 705 East 187th Street on the corner of Beaumont Avenue. We're about 2-3 blocks down from the Bronx Zoo off of 187th and Southern Boulevard. We are a small pharmacy that also has a surgical supply store next to it. But we have a robust business that services not only the Bronx community, but also the Westchester County market as well. And we also have patients and facilities and accounts that we service throughout Queens, Manhattan, and Brooklyn as well. So we're here 7 days a week. We're open late. We are in the business to service our patients, serve our community, and provide the best healthcare outcomes that we can to our patients.
Little Italy, one of my favorite places in the borough of the Bronx. All right, Javier, thank you so much for being with us here on the Social Justice Forums. We appreciate the insight that you provided towards community pharmacies, and hopefully we can do our best to continue to preserve yours as well as others who have provided a much needed service. And again, thank you guys for being essential workers and really rising to the challenge in the midst of our COVID-19 pandemic. Thank you much.
Thank you for the opportunity. Thank you for the platform. Greatly appreciate it.
Appreciate you. All right. Want you to stay with us because guess what? We've got more on the Social Justice Forums. Don't go anywhere. We'll return right after this.